CBS News medical contributor and researcher at the University of Southern California, Dr. David Agus, joins us from Los Angeles. How remarkable is it that you have a 91-year-old who is now showing no signs of cancer?
I think it's amazing. Several years ago, metastatic melanoma, especially in the brain, was a death sentence. Now, with some of these new treatments, it's becoming a life sentence. And Jimmy Carter is a hero for stepping up and being transparent and talking about his disease and what's going on.
He's been receiving this immunotherapy treatment, a drug, its brand name is Keytruda, right? How amazing is it that this was fast-tracked through the FDA, and what's its potential here?
So when cancers happen, they have a don't eat me signal on their surface. And this is a drug that blocks that don't eat me signal so that the immune cells can come in and eat the cancer. And in a good percentage of patients, they have significant benefit. It obviously works in metastatic melanoma. It is approved in kidney cancer. It works in lung cancer. And literally, as we speak, it's being tried in other cancers. It's not a cure-all. It doesn't cure the disease, but it does delay its progression and significantly benefit patients.
Dr. Agus, when we're talking about harnessing the power of the body's own immune system, how much more work is there to do on this front for getting your body essentially to heal itself?
You know, it's just the beginning of a new era of therapy. Immunotherapy was first tried in the late 1890s, and the first drug approved to treat cancers happened in the last several years. So that's a big learning scale that it took almost 100 years to do this. At the same time, we're getting better literally as we speak.
Does this drug have the potential to replace chemotherapy?
Well, it did in melanoma. Chemotherapy in melanoma bought several weeks of life with significant side effects. This drug, by months to years, with significantly less side effects.
What will you be looking for as an expert in cancer research for the former president to be in remission?
So right now, the only way we can follow this disease is by doing a scan, an image, where we can use an MRI to look at the brain and a CAT scan to look at the body. And they look to see if there are any changes in the lesion of the brain or any new lesions where anything pops up in the lung, the liver, and the bone where it classically goes with melanoma. So this is the beginning, and it's a remarkable report card he just got, but it's certainly not the end. And we have hopefully many more months to years of following his response to this particular therapy.
Dr. Agus, thank you so much for sharing your insight.
Thank you. It's my privilege.